This is for 6/16 and Wednesday, and we're very happy to have someone from the VNA with us, Sonny Deroma, Vice President of Development and Innovation of the VNA Healthcare, and they're centered in Aurora. And VNA has been a part of as a heart of ministry that I've been really thinking about in the last months here. So we're going to bring up Sonny now, and I got to find him on my in my Zooms, in my screen here. Here we go. We're going to bring him up. And we thank him for coming by, and we're going to move down a little logo to make it a little bigger here. So Sonny's with us, and we welcome him to our show today. Sonny, just give us a little about your background and a little about where VNA is going, and we'll just hand it over to you because we're just learning here more about the pandemic and the beautiful work of the VNA. So, Sonny Deroma, just thank you for being with us this morning. Actually, it's afternoon, but it's morning on the tape. Sorry about that, folks.
Oh, thank you, John, for having me on your program. Good afternoon, everyone. I'm Sonny Deroma with VNA Healthcare, as John mentioned. Actually, born and raised in Chicago. Went to school here at Loyola University, Chicago, and I've been in the healthcare space for over 20 years. I actually worked for VNA and left VNA in 2014. Back in the day, I had responsibilities for our home-based services, which was our house calls and home-based home health and hospice services. And I rejoined the VNA in October of 2020 after spending some time working with some health plans in the various markets here locally as well as nationally. Very excited to be back at VNA. And as John mentioned, I felt a need to return to take care of some unfinished business. As many of you may know, the VNA is an organization that's been serving this market for over 100 years. Really started as visiting nurses. So you talk about care in the home. That's what VNA first started before there were programs like house calls and home health, etc. So we became a community-based health center in 2002 and currently provide services to over 74,000 unduplicated patients in our markets here in Kane and Kendall and Will and DuPage County. So really excited to be at VNA. As many of you know, we're still challenged with the pandemic. Luckily, there's a light at the end of the tunnel, and what we're doing at VNA is providing services and vaccinations here at our health centers, one of 10 health centers that make up the VNA network, as well as providing vaccination clinics at employers and manufacturers and organizations and churches. And also, I have oversight for our home care team as well. So we're doing a lot of vaccinations for those that are homebound. As many folks were accessing care or vaccinations at the local Walgreens or the CVS or at other clinics run or managed by VNA or at a hospital, a lot of our folks that were considered homebound were not getting access to the vaccines. They may have been on a number of lists that they signed up for, but were not able to attend a clinic again because they're considered homebound. So over the last now 3 months, we have been doing a lot of homebound vaccinations. I can tell you, John, a lot of these patients are just so grateful that we have our nurses come into their home, vaccinate themselves, vaccinate the patients as well as their caregivers or loved ones, because they're just so appreciative of the fact that now they're vaccinated. So we still have in my opinion, a long way to go. Even though Illinois is starting to open up as of last Friday, there are still a fair percentage of folks in our communities that have not gotten vaccinated. So we want to make sure that we work with all the local organizations and let them know that VNA is here to support the communities. We don't charge for the vaccinations. So our goal and mission as the VNA is to vaccinate as many people as possible. So the folks we vaccinate are safe, their loved ones are safe, and the communities that they live in are safe. So we're trying to do our best to promote that. And we are approaching 50,000 folks to be vaccinated. Our goal is to hit 50,000 by July 4th, and we are like right there. So we got a couple of weeks here to hit that milestone. We hit that number, that's going to be a huge accomplishment. And again, we're trending in the right direction, and it's because of all the hard work of our associates as well as the communities that have asked us to really support them and their loved ones and their employees and their associates. So really appreciate everyone's help on the VNA, and we have a lot of unfinished work to do, but our goal really is to continue to support the communities and to provide services as needed to those individuals that unfortunately may not have access to the care during these very challenging times. So,
Yeah, Sonny, I guess it was a couple weeks ago. I don't know I forgot the date now, but the Aurora Beacon had a nice front page. I don't know if that was Denise Crosby or just a general article, but it was a nice
it was Denise
article.
Crosby.
It
Yes,
was
John.
Denise. It was
It was.
Denise. And a friend, Heather, was featured
Yes.
there. And it was a nice about what you're talking about, getting out to people that, for some reasons can't get to these other providers, even I mean, they just can't drive up or come
Sure.
to the office. So
Sure.
they're going out to them. And this this thought about no cost, that's very beautiful. And they can just be helped. And yesterday I had my eyes checked, and the doctor there was I got talking about this stuff because he's a good man, good Christian man, and talking about vaccinations. And he was telling me that one of his patients, that this is I'll contain the place, Wheaton Eye Clinic, that one of his patients somehow or another got COVID. And it was because the poor gentleman did not get the vaccination. 75 years old and not taking the vaccination. And it's just so sad. And I don't want to name names, but we've seen people in paper articles, sports people, right now who just have not taken the vaccination. Some of them get ill, some of them die. If anybody, I would say, maybe you don't have to get into this, but if anybody gets COVID now, it's probably because they didn't take a vaccination, basically. I mean, there's people that cannot do it, as we talked about the homebound, but we're working on that. You are, but basically, anybody right now, their vaccinations are available. Wouldn't you say they are pretty available?
Absolutely. I think if we go back 6, 7 months, John, the demand for vaccines was high, but the supply was low. Well, now
Right,
it's changed dramatically.
right.
And to your point, I think it was Denise Crosby that actually went on a ride along with Heather Worse, one of our RNs who's been with the VNA for going on 20 years now, and provided some vaccines for some patients that were homebound. And again, we're doing this not just for VNA patients. These are patients that may be going to other providers in our market. So these aren't just for VNA patients. We're trying to provide those vaccines to anyone that needs a vaccination. But to your point, I think initially because of the mad rush to get vaccine and a lot of vaccinations were not available, there was a lot of misinformation kind of circling around the areas here and in the neighborhoods, and people just became very concerned. But the good news is that we are trending in the right direction, having more people get vaccinated, but there are still a fair number, a percentage of folks that have not been vaccinated. And you know what? When all is said and done, people have the freedom of choice to make a decision on their own. But I do feel that there are some people that just were not informed initially. And there were some that were on a number of lists, as I mentioned earlier, 5, 10 lists from various places to sign up. They never received a phone call and they kind of lost hope. So I'm urging everyone to reach out to the VNA, reach out to your provider. And if you have questions, this is the time to do so, because again, it's been proven that these vaccines are working. And kudos to all the folks that have really been in the forefront providing care and getting these vaccines together for our community. But get vaccinated. Again, take care of yourself, take care of your family and your loved ones. But again, I think now that you can see the demand going down, and the supply of vaccines readily available compared to 6, 7 months ago, this is a time really to kind of level set and ask those questions just to make sure that you understand why it is important to get vaccinated. Once you do that, and then you can make a well-informed decision whether you get vaccinated or not, at least you'll have the information. I think initially during that mad rush, a lot of folks just didn't have the information and just kind of assumed the worst and kind of take a wait and see approach. But now, 2, 3, 4, 5, 6 months later, I think people can kind of see that the number of positive tests has gone down. The percentage of folks getting vaccinated has gone up. So it's really a good time to really kind of hit that reset button and kind of check in and make sure that you have all the information needed to make a well-informed decision.
Yeah, and right now, I'm just going to put this up real fast here, Sonny.
Sure.
This is my COVID tracker for the last few days. You can see that in the side there a little, but it doesn't have the county down here. The county is on this, but it's not showing here why we got our screen here.
Yep.
But the state numbers yesterday, there was only 9 deaths and only 165 cases. And I think Kane had 11 new cases and 1 death. So we can see that the trend is going in the right direction that way.
Absolutely.
I don't want to be an alarmist, but I think we have to somewhat worry about these variants coming. Maybe I guess they are coming. I don't know about how. I know England just has kept their mandates on for another month because the variant there, I guess it's called Delta, I think, the
Mm-hmm.
Delta variant. So we
Mm-hmm.
got to get more people vaccinated. And here, what shots are you offering? I think you offer all 3 of the shots, if I'm not mistaken, or how is that?
Yes, John. Yeah, we are offering J&J, Pfizer, and Moderna. For our homebound patients, we are offering J&J and Pfizer. And we also, as I mentioned earlier, are doing some clinics at offsite locations at manufacturers, employers, companies, senior living facilities, independent living facilities, churches. So depending on the needs of the patients or the attendees, we can offer, any of the 3. But yeah, we offer all 3 and have offered the 3 vaccines from the beginning. So again, we have a ample supply of vaccine where again, that was not the case a few months ago. So do your homework and ask questions. Feel free to reach out, visit us at our vnahealth.com website to learn more about the vaccines available. And again, that'll kind of help you make a well-informed decision on next steps in the process.
Yeah, I've been trying to help Sonny somewhat. I haven't. My success is not there yet, but we've been trying to reach out verbally and also with messages to the church community to be involved. And Sonny, you've had several churches that have been involved. I know you had a nice clinic there at St. John's AME that was a large one early. Well, I don't know about early, but it was earlier than it's a few months ago now that
Mhm.
you had that one. And you have some others, maybe half a dozen or more, but you want to explain how the churches can get involved a little in this?
Sure. Yeah, John, to your point earlier, maybe 3 months ago, we vaccinated. We actually had an on-site vaccination clinic at St. John's in Aurora. We vaccinated over 700 people. And we're working with the local churches because we want them to know that we need their help. There are still many parishioners, as I mentioned earlier, about the misinformation that many of our folks in our communities have, and they look to the church for guidance and for information. So we're working with a number of churches in our local communities here in Kane and Kendall and DuPage County and Will County, just to let them know that we're here to provide information and need their help to just let their parishioners know that VNA is here to support and provide vaccines at no cost and to reach out and ask questions. So again, it goes back to what I said before about a lot of people just not having information or perhaps have lost some hope or we're taking a wait and see approach. So our goal is to connect with a number of churches. And to your point, we've held vaccination clinics at the churches' locations, about half a dozen over the last few months. Been very well received. We haven't had a what I call a mega clinic like a St. John's where we vaccinated over 70 or 700 people. But some of
Right.
these clinics that we've set up at churches, we vaccinated 30 or 40, 50. And even though it's not 700, you know what? Those are 30 or 40 people that are now vaccinated. So
Right.
a lot of the churches we've been working with have been very helpful and gracious in getting the word out. So our goal is to connect with the churches, be involved in some of their meetings, and just to let people know that the VNA is here, provide some additional education on vaccinations, again, to folks who make a well-informed decision. Because again, there's still a fair percentage of those folks that have not gotten vaccinated. We want to make sure those folks know what's available to them.
Yeah, and I just talked to Sonny before we went on air here. We're going to try to do a clergy community talk time on Zoom next week, so clergy can be involved. So we're going to try to do that next Wednesday, Lord willing, as we would say. And Sonny, it just have been a blessing to talk with you. And the number of people you can see we got the screen rolling down there. I've had this for a long time. I always appreciate VNA, so we've had this running, this type of tracker down at the bottom of the screen. To call that number and get more information, you get it online at the VNA website. And they're on Facebook too. They're all around. They're trying to reach out. So remember the vaccinations. Call this number. Are you doing walk-ins or not? I forgot. I know you set appointments and they get in, but can they just walk right in, or what's your thoughts on that, Sonny?
Great question. Yeah, we actually started taking walk-ins again just a few weeks ago. So walk-ins, getting vaccinated does not have to be through an appointment. You can walk in. We also have a drive-through at some of our locations, and of course, too, our focus is also on primary care. So a lot of folks have not been to their primary care physician during
Wow,
COVID.
yeah.
Right? They've been kind of sequestered in their own home. Of course, that's great. So if you've not gone out to see your physician, please do so. If you're with VNA, please come out and visit us at one of our health centers. We have obviously primary care physicians and specialty care, as well as dental and optometry and podiatry here. And of course, we have our home care business and services that are part of the VNA. So please, re-engage with your primary care physician, whether it be with VNA or not. Again, we have worked together to challenge and meet the challenges of this pandemic. But as things are starting to ease up and we are now getting to a point of some sense of normalcy, we want to make sure that people are engaging with their providers for their routine annual physical, which perhaps maybe we haven't done that, right, in quite some time. And then in a month or two, John, will be focusing on flu vaccines, which is more important now than it has been in the past, to make sure that we continue to stay on top of these vaccinations. So it's an opportunity for us to, again, to reconnect with all the patients and members in our community. So again, please connect with your provider. If it's VNA, great, let us know. But we're here to support you, whether it be for the vaccinations for COVID, primary care, specialty care, and of course, flu vaccines, which will of course be kind of top of mind here in the next upcoming weeks.
Yeah, that about getting this pandemic down, it also helps, and it's noticed at hospitals and other places that it opens up beds and other things that helps the whole health of everybody to get this pandemic under control. And during the last months here, because of masking, the rates of flu and colds were like really low, right, Sonny? They just dropped drastically. It proves inside stuff is where we're getting this spreads on these type of viruses, and that's what we got to worry about, the COVID too, that way, that the fall and the winter coming up. So we got to get the vaccinations into people's arms, even if the variants, I just heard about that. We don't know how effective they're going to be effective, the shots. So you can't say, oh, it's not going to work. It's might be a little less than 90%. Maybe it's going to be 85. We don't know. But
right.
And we might need to have a little booster or something too. We don't know that yet. That probably is going to happen too, probably, right, Sonny? Maybe a booster or another shot coming down the road.
Yes, our understanding is that's still a work in progress, John, as the CDC kind of builds our guidelines. I think the key right now is to get that initial vaccination, right, whether it be Pfizer or J&J or Moderna, and more information will come as we approach the end of this year, and there might be the need for a booster. But to your point, yeah, there's still a lot of information and a lot of things that need to be ironed out. But the key, again, get vaccinated, and as more information comes, reach out to your providers for some guidance, and just do your best to stay well and stay healthy.
Yeah. Well, thank you, Sonny, for being with us. did talk to one church clergy group that says they're maybe interested. I think there are going to be some more. Hopefully we'll connect with some more here, and our time next Wednesday will help that too. So
Great.
we want to reach out to clergy, but we want to reach out to everybody, businesses and individuals. And like the homebound, as Sonny was saying, it's a very beautiful thing. They go out to the homebound. So I want to thank Sonny for joining me today and just being with us. And Sonny, it was a blessing to have you with me. And I'm just going to bring up a couple more, just a couple items here, more housekeeping, maybe more. Just 1 second here. One other thing, this weekend, if you got some time, go to the Juneteenth event at MLK Park on the east side. It's this Saturday. It's going to be on Saturday. And so I just want to thank Sonny for joining me, and we'll see you hopefully on Friday with the guest too, and that's coming up at Friday at 5. And so again, I just want to thank Sonny, and so God bless everybody out there, and bye-bye. We'll see you soon again. Bye-bye now.
Be well. Take care, John. Everyone.